Breaking news, President Trump's legislative agenda, what he calls his one big beautiful bill, just failed to make it out of a key committee. 5 Republicans jumped ship and joined Democrats to vote down the bill. Our smart reporters are here, including and especially our all-star Capitol Hill reporter, Lauren Fox. Lauren, I want to bring you in, but I first want to play a soundbite from Chip Roy, Republican of Texas, who has been kind of leading the charge on concerns about his fellow Republicans and this bill.
I have to now admonish my colleagues on this side of the aisle. This bill falls profoundly short. It does not do what we say it does with respect to deficits. The fact of the matter is, on the spending, what we're dealing with here on tax cuts and spending, a massive front-loaded deficit increase. And if we would reform Medicaid, we could actually get to the core of the problem. But we refuse to do it. And I'm not going to sit here and say that everything is hunky-dory when this is the budget committee. This is the budget committee. We are supposed to do something to actually result in balanced budgets. We are writing checks we cannot cash, and our children are going to pay the price. So I am a no on this bill unless serious reforms are made today, tomorrow, Sunday. We're having conversations as we speak, but something needs to change, or you're not going to get my support.
Lauren, he's pretty emphatic.
Yeah, and let's just put this into context. The Speaker wanted to move forward with this bill, get it to the House floor, pass it before the Memorial Day recess. That's next Thursday. Obviously, this is a huge setback for the Speaker. I'm really surprised that they ended up having this vote in committee because these holdouts had been voicing concerns over the course of the last 24 hours. There have been numerous meetings, including Steve Scalise, the majority leader, meeting with these members in the ante room off the committee as it was ongoing. When they came back into the room, each of them spoke. It was very clear they still had concerns, still had opposition. They want to see some of these spending cuts sped up rather than delayed into later years. There's a reason Republicans did that, because it does take time to implement some of these things. But that's not enough for these Freedom Caucus members. And unlike past budget committees, this budget committee is full of conservatives. And that has really potentially slowed down this process.
So the spending cuts and the demand for more and earlier spending cuts is a big part of the reason why this big bill is stuck right now. Another is the fact that to pay for some of the spending cuts that are already in there, the Republicans are putting cuts to Medicaid. Right now, the changes to Medicaid include adding a work requirement for able-bodied adults, implementing stricter eligibility rules, like re-verifying who is eligible every 6 months, adding co-payments, cutting funding for states that allow undocumented people to enroll. I want to go to Tom Foreman, because Tom, you're at the magic wall, and I'd like for you to walk through how Medicaid actually works currently, who it covers, and what it costs.
Yeah, and think about those changes you just mentioned there as we go through it. When you talk about Medicaid, it is a government health insurance program for low-income and disabled Americans, including children. It's not Medicare, which is generally for older people. Medicaid for people who are struggling. 72 million people, they pay little, if any, out of pocket for their care. It was established in 1965 by Congress. Who's on it? 4 out of 10 children in this country. 1 out of 6 U.S. adults. People with a median income of $36,000 a year. So not much at all. What does it cover? Usual stuff: births, hospital stays, nursing home health care, vaccinations, prescription drugs. This is where it gets sticky when you get to the cost of it. It is paid for more by the federal government, $606 billion in funding a year, less by state governments, but it is a mixed program out there. It is not the most expensive entitlement program, about 9% or 10% of the budget. The work requirement question, interesting. 64% of the people who are getting it right now already work full or part-time. Not working because of caregiving, that's about 12%. If you're a parent and it costs more for care for your children or for your parents than you can make in a job, well, then this is the right decision economically for you at least. Not working due to illness or disability, 10%. Not working because they're in school trying to get a better job, make more money, 7%. And 8% are either retired or they just can't get a job for some other reason. And importantly, when these lawmakers look at it, everyone has skin in this game. Look, if you look here, the lightest states have the least number of people enrolled by a percentage. The darker it gets, the more it's enrolled. But yeah, would this hit big states like California and Oregon that tend to vote blue? Absolutely. But there are a ton of red states in here with a tremendous number of people on average 28%. There's not one lawmaker who can touch this without having a significant part of his base feel the pain.
Tom, that last map really does tell the story of why this part of the fight on this bill is so critical, and it does not fall on partisan lines or even geographical lines because of how much Medicaid affects every single district. Thank you so much, Tom. Appreciate that. And Zolan, on that note, I'm old enough to remember back when Obamacare passed. One of the things that you heard from the president and his top aides, Rahm Emanuel, was that when you pass a new right or something that people can have, whether it's Obamacare, but specifically within Obamacare was Medicaid expansion, it's hard to take it back. What we are seeing now is that play out.
That's right, and the anxiety amongst public officials on the Hill, but also some people in the White House I've spoken to and some people around the president who fear what would happen if you did slash a program that many of the president's own supporters rely on here as well. The reporting I have thus far, I don't think the president is in the details of these negotiations at this point, but he does want to walk away with this with as little political backlash have you seen. And sometimes that even means like a true social post that would go against Republican norms, like, okay, tax the rich for this, to pay for it. But I do know that for those around close to the president, that when it comes to benefits, Medicaid benefits, they don't want the political backlash that comes with that.
Which is why I just want to play this because it really does speak to that. You hear the semantics and the attempt at branding what they are trying to do to Medicaid as reform. But it's not just Democrats who aren't buying that, it's some of the most prominent Republicans. Let's listen.
We're not cutting Medicaid. Stop buying that.
And then you can look at Medicaid cuts, Medicaid reforms, I should say.
We're not talking here about just work requirements. The House goes much, much, much further than that. This is real Medicaid benefit cuts. I can't support that. No Republican should support that.
Even Steve Bannon has said, you cannot cut Medicaid. It will hurt us with our voters. It's not just Democratic voters. So that's why you also saw the president not even put in his budget proposal the word Medicaid.
Yeah, and if you go back, there are numerous instances of President Trump saying, we will not cut Medicaid, precious Medicaid, we will keep Medicaid. Though there is sometimes some nuance in the way he says it, indicating that, he's talking about people who are disabled, children, mothers. The able-bodied thing is where I think he has left a tiny bit of nuance in his rhetoric.
Yeah, and the challenge, as Tom pointed out, is that some of those able-bodied people, 12%, are taking care of their loved ones, and that's why they're getting Medicaid.